So shifting a little bit to keeping track of appointments, which can be grueling and a lot to manage, especially if caregivers who often, I think, take the role of making sure appointments are made and rescheduling and doing these things. Having a calendar is probably the most important way to get organized with appointments, and that can be any kind of calendar, a written calendar that you carry in your pocket, a calendar on your phone, a calendar on your refrigerator, next to your bed, whatever works for you, having some way to keep track of the dates and the times. OSU MyChart is a great way to also keep track of appointments. OSU MyChart is basically being able to access your chart, your appointment times, all online through OSU. And it's pretty easy to sign up. You have to get a sign-in code basically when you come in. Anytime you come in for any kind of appointment to the James, to OSU, you can ask the scheduler, the person that you check in with, just say, hey, I want to sign up for OSU MyChart, and they'll give you a little code that you can use to sign up for it online. And then it's a pretty easy process. It's like your name, date of birth. I think you need your medical record number, and then this code, and then you can set up your access to OSU MyChart where you can see all of your appointments, the dates, what times, who they're with. You can use the MyChart to see, test results, to communicate with your providers if you'd like to use that as an option as well. Appointments, another option that you can utilize is asking your provider to print out an after visit summary. So after visit summaries often include when your next follow-up appointment is. So say you forget to write it down, or you don't have it, you don't have a pen with you, or you don't have your calendar with you, they can give you a printout so you can take it home and add it to your calendar. And then there's also this Cancer Guide app, which is an app that has been developed by the LIVESTRONG program, and there's a little quick video that I want to show that gives a little bit of a preview of what this Cancer Guide app looks like and how it can be utilized.
I'm Dr. Brandon Hayes-Latin, LIVESTRONG's Senior Medical Advisor. Welcome to the LIVESTRONG Cancer Guide and Tracker. At LiveStrong, we believe you should have the information and tools you need to make well-informed decisions throughout your cancer journey. That's why we're introducing the LiveStrong Cancer Guide and Tracker iPad app, which lets you store and access information relevant to your treatment and survivorship electronically. The Cancer Guide will help you know what to expect, learn what questions to ask, and connect to resources. The tracker helps you organize your appointments, treatment information, and medications, as well as provides a daily journal space and a symptom tracker. We hope you'll share the information from these tools with your loved ones and healthcare providers to get the support you need throughout your cancer experience. We created this app as our first step in helping patients store, access, and share their cancer data. LiveStrong will continue to add and enhance functionality to the app to help improve the quality of care, engage patients in clinical decisions, and facilitate research for improved health outcomes. Thanks, and live strong.
Okay, so I think that gives a little bit of a introduction to what that app looks like. So you could use it on your phone or your iPad. What I am accustomed to is seeing that LiveStrong Guide app as not an app, but an actual binder full of information. I have some in my office that I've given to patients before, so that also still exists. You don't have to use the app version of it. They do still do a paper version of the same thing where you can track, you can journal, you can keep your appointments, you can write down questions. There's a resource guide in it. So if an app seems too overwhelming, you can still order an option to have a physical app that's paper, or not an app, a physical cancer guide that you can hold that's tangible, if that fits your needs better. So as far as organizing medical information and medication, there's lots of different ways to do this. And again, lots of apps, lots of kits that are available to use. There's it seems like there are endless options for, different things you can use to get organized. Keeping a journal is a great way to just keep track of medical information, side effects. I know sometimes it can be really hard when you go into a doctor's appointment and they ask, how are you doing? Well, my goodness, how am I doing? I've been nauseous lately. Well, how long has that been going on? And does it last all day and multiple times a day? And when you take your medication, does it help? Or it can be very overwhelming to answer lots of questions about how you're feeling and how things are going. So keeping a journal can be really helpful, just a day-to-day, what your thoughts are, or even just how you felt that day, what symptoms were happening, what made things better. Checking in and keeping a journal can be helpful for documentation purposes to help trigger your memory and convey important information to your medical team. OSU MyChart is another great way to access your own medical information. So in addition to keeping track of appointments, the MyChart option is great for keeping track of medical info as well. And then, of course, there's another app, the CancerNet mobile app. And this one, I think, from what I've seen how it works, and it's great specifically for the medication standpoint. So it lets you save information about all of your prescriptions, and then it has these options for you to take a photo of the labels of your medication. So it's almost like you're carrying around all your medications without actually having to carry all the bottles. And then it also has a symptom tracker and a bunch of information about side effects and other medication information. And then there's also the American Cancer Society Personal Health Manager Kit. This is, I guess, somewhat similar to the LiveStrong Cancer Guide as well, but same type of thing where it's not an app, it's an actual physical paper kit that helps with organizing appointments, medications, insurance, bills. You can personalize it, and you can call or get online to order one of those. And again, that's not an app, but something that is tangible and paper version. And then, of course, pill boxes are a great way to organize medication. There are, from what I've seen, a million different types of pill boxes. It's actually super overwhelming. 7-day, 14-day, Monday through Friday, AM, PM only. I mean, there are lots of options. So you should be able to find something that fits your needs. And you can often you can order pill boxes. You could ask your pharmacist about pill boxes. The James has clinical pharmacists you can inquire about getting a pill box from as well, or different ways to organize. Sometimes people use medication calendars if they're not fans of pill boxes, or using a color coding system. So using a Sharpie or something to color the tops for AM, PM, or whatever kind of organizational system makes sense for you is the one to use. If pill boxes don't work for you, and I have asked patients before, how do you organize your pills, or how do you stay medication organized, and they point to their caregiver and say, he or she does it. So whatever works for you to organize is the way that you should do it. There's no right way. There's lots of right ways. And questions. So I think both patients and caregivers often have questions that come up all the time about what's going on with their loved one's medical care or finances. I mean, questions can arise about just about anything. So keeping a running list is important, and having something to write it down all the time. So carrying a little notebook with you. People are using their phones a lot to jot down questions. Keeping a notepad by the phone or by the bedside so that you can keep a running list of questions and remember them, because things can get pretty overwhelming and chaotic quickly. So if you don't write it down, you might forget or lose track of it. If you have questions, you can also, I think it's important to remember that even if you don't have, your loved one doesn't have an appointment with their doctor for several weeks, you can always call and schedule a consultation if you'd like to see your doctor sooner than that, to see if you could be fit in, or if you could talk to maybe the nurse practitioner or somebody. So I always advocate that if you do have questions, you don't necessarily have to wait until your next appointment. You can get in touch with your medical team and say, hey, I have some questions. How can I get these answered? OSU MyChart's popping up here again because there's a great way to send messages to your medical team via MyChart. So It's kind of like an email system, but it becomes part of your medical record. So all of that information is tracked if you send a message to one of your providers if you have a question. So it's a quick and easy way to send something that's maybe not so emergent. It's not a great way if you're having an emergency. I would say not to use OSU MyChart for that, but for more general questions that don't need an immediate response, that's a good avenue. So the National Comprehensive Cancer Society has a Pocket Cancer Care Guide app. The National Coalition for Cancer Survivorship designed this, where the app has like a list of questions that other cancer patients or caregivers have asked to maybe help you generate ideas for different questions or how to ask. You can build your list to help you guide a conversation when you come in for an appointment. I like that it has a recording aspect of it, so you can record what your physician or your nurse or your oncologist has to say back to you, because you may not catch it all when it's coming at you, so having a recording of it can actually be really helpful. The side note on that is I think it's always best to ask your doctor or your nurse if it's okay if you record them, because I think there will probably be different preferences on whether or not they want to be recorded or not. So it's always important to ask permission before you do that. There's also a glossary, which is really helpful. I feel like a lot of times I'm Googling, different terminology that I see in charts. I'm like, oh, I don't know what that means. I got to look that up. So I can only imagine being a caregiver, listening to this information, being that second set of ears and trying to take it all in and not knowing what that means and not maybe necessarily wanting to jump in and say, what's that? Explain that. So this app is kind of nice because it has a little glossary on it so that you can look up terms as you go. And you can also link appointments and other things to it. But really, this app is great for questions and getting organized with asking those questions and organizing the responses that you may get. Emergencies are another time when organization can be key. So it seems like inevitably, as a caregiver, there's probably going to be some emergency that comes up, and being prepared and organized and ready to respond is really important. So making sure that you have important numbers with you saved in your phone, carry them in your wallet, in your purse, somewhere where they're very accessible. You also want to have what you need with you in case an emergency arises. So one example that I know I've seen before is if people are worried about their blood sugar or something like that, having snacks or something always with you in your purse, or there are all kinds of things that you can carry with you, medication, cleanup supplies, anything that you may need, have a little emergency bag or something that you can take with you. The ER is, always, if there's an emergency, you should go to the ER. And there's also the part of the ER that's James specific for James patients, which can be nice as well, where you have physicians and people who are, oncology knowledgeable to treat you if you go to the ER. And then one thing I wanted to review quickly here is on the website is listed on the slide. So if you go back and check out these slides later, you can get the website for this. Or if you go to patient education on OSU's website, there is this really great resource on emergency care for patients of the James. I just kind of stumbled upon this and didn't know it existed until just a few days ago, for what to do basically in an emergency. So what to do if the doctor's office is closed. You can call. Usually you will get somebody on call. There's a little blurb here about medicine refills. So knowing, before a weekend or before going on vacation, checking to make sure that you're not going to be out of medications and giving your doctor at least a week to get things refilled. But what I like is all of these different symptoms. So symptoms and when to call your doctor. So they list a symptom, what a common problem might be, and what action you should take. So for example, if you're having bleeding in your urine, you're going to want to call your doctor right away, even if you've been given different instructions. If you have blood in your vomit or stool, you should call your doctor right away. There's if you're bleeding from your nose, a little blurb about first aid, and then if the bleeding doesn't stop within 10 minutes, call your doctor. So they go through fever, cold symptoms, mouth sores, nausea. I mean, there's chest pain is one where it's like immediately call 911, skip calling the doctor, skip waiting 24 hours. This is one where you want to take action quickly. So I think this is really a helpful thing because sometimes I feel like all different things come up and you don't really know, is this an emergency? Is it not? What should I do? Who do I call? What do I do? And so it also has this little organizational tool at the end where you can write in phone numbers for your oncologist, your nurse practitioner, your family or primary doctor. This is the number for after hours. If you call after 5 p.m., this number, if there's an emergency or you have a question, the operator can page whoever is on call to address your concerns. And then some other places for other important numbers, maybe family members or friends or other providers that you would want to have. So I think this information can be helpful when you feel like you might have an emergency and you kind of don't know what to do. This could provide some guidance.